This could be a real patient struggling to breathe, but fortunately it's only a mannequin. And it's just one of the many new features that will be used at the University of Portsmouth, which has launched a new centre for nursing, as well as a new adult nursing degree.
Our facility has been designed really to think about the nurse of the future. We have a fantastic resource here, which is 50% community facing and 50% more like an acute setting, as you see behind me here. And that's because the population's changing, so nursing needs to do things very differently. Our graduates will be working in community much more than in acute settings. They'll be managing long-term conditions as long as they're stable in the community. They'll be keeping people at home and trying to help with the avoiding hospital admission, because we know that acute trusts and NHS trusts in particular are really struggling at the moment.
We recognise that healthcare of the future is about taking that care to the patient. And so we have a full GP surgery. We have 2 consulting rooms in that GP surgery. We have an old people's home. And then we have the wards and the side rooms and the mannequins and the actors and things like that. So it's about looking at healthcare of the future and having this joined up approach between acute healthcare and social healthcare. And I think that's what sets us aside a little bit.
The first cohort of 118 students began the 3-year program in January. During their studies, they have the opportunity to simulate many situations they might come across during their professional career.
Our students work here 1 day a week in simulation. Through a day, you can get 118 students through 3 simulation activities, so short, sharp, evidence-based activities that will really help them think about their performance and how they learn. Simulation provides an opportunity for students to learn in safe environments. We can structure scenarios so that particular things happen, and students can experience things that they might not see in practice, but they can think about how they would then respond to it if we simulate that activity here.
Listening to these mannequins is actually like listening to a person, so it's quite surreal to actually be able to practice without obviously harming a patient, but yeah, actually doing it on the mannequins. It's very good. We can change the settings on the mannequins, so we can put them in like different conditions, different illnesses. So rather than have to work on like a vulnerable, ill patient, we get to practice it here, which does make us feel more confident for our placements in May.
Apart from the lifelike mannequins which can breathe, simulate heartbeats, blink or react to drugs, the new facility also includes a 3-day virtual cadaver that allows students to explore inside the human body.
Anatomy and physiology historically is very difficult to learn. It's complex subjects, it's large classrooms, and it's not contextual, so it can take a long time to learn. So we use this technology, have groups of students around it, create quizzes, and then they can interrogate the anatomage table and learn anatomy that makes it realistic for them. But more than that, it's fun. And if something is contextual and fun, it's easier to learn. And so that's why we use these types of devices. The cadavers, so the images are real, they're real images. We use CT data and MRI data. We can import our own data, and we're doing that for some research projects that we're undertaking. But there's also real cases. So a cardiac arrest, for example, on this table, you can simulate a cardiac arrest. So students can physically see this is what's happening throughout the entire process. Instead of waiting years to learn that experientially, we can show them very quickly, and then we can put it into context of how you might treat that.
And also to observe your students, you have this eye-gazing technology. Tell me about it.
So eye-gaze technology is where we put a pair of glasses onto a student, and then we can see what they're looking at, and at the same time we can look into their own eyes. If we want to test a student on their communication skills, we want to see whether the student is looking into the patient's eyes, for example, then we will create a scenario with an actor maybe, put the glasses on the student, ask them to do an introduction, and then we'll review that video to see what they were looking at. If they were constantly looking at the patient's feet, then we can say, look, we need to lift up your gaze. And sometimes that's quite a challenge to do. So, but when students can observe their own video, it confirms that knowledge for them.
I think the key thing for us is about the use of the space, the use of the technology to enhance learning. So our ambition is that our graduates will go out and work to keep people safe, to keep them in the community where they really want to be, and to improve the image for nursing and for the university.
Nicole Ris, for That's Solent.